It's Tuesday, so you know what that means. The papers are hitting the streets. Some of you may already have them on your front porches right now. So in studio, Mr. Patrick Munsey, Editor-in-Chief. It's back.
That's right. Good morning.
What's new and exciting in the paper this week?
The big news here would be Howard Regional Health. They just announced with us this morning exclusively that they are getting an investment of $23 million.
Wow.
And this is going to kick off what looks like about 2 years of improvements and upgrades for the hospital. We're going to see an expanded intensive care unit. We're going to see a new cath lab, just a whole lot of stuff. And then in the second phase, we're going to see some community health centers, urgent care treatment centers,
Sure.
Things like that, physician recruitment. So we're talking about a lot of really big changes in a really short period of time at Howard Regional. I'm pretty excited about it.
Yeah.
That means more jobs, more stability for the community, and Howard Regional becomes that true regional health care center that they've wanted to be ever since they rebranded a few years ago.
And that means new technology comes as well, correct?
Absolutely. Well, with the ICU alone, what they have now is, I believe it's a 6-bed ICU with 2 beds for cardiopulmonary intensive care, and they're always full. Almost always. So they have to ship people over to St. Joe or, heaven forbid, send them to Indianapolis to get their intensive care treatment. And that's risky for the patient. So what they've done is the round area. If you're familiar with Howard Regional Hospital, the southeast corner is a round tower-like structure. So they're gutting the second floor of that, and that will become the new intensive care unit. And it's going to have roughly triple the number of beds.
And the process has already started with that?
Well, they're going to start construction within 90 days, and they believe that they'll be finished within 14 months. And
so that's a huge shot in the arm for Kokomo as well.
Absolutely, and they're really happy with the way that round room sets up because they can centrally locate a nurse's station, and so that's going to save them in response time. It's going to save them in staffing. They're going to be able to treat those people more efficiently, more effectively, much more quickly, be able to monitor them more closely, which is what you want in an intensive care unit. So really we're talking about a major upgrade in some of the most important services that they're going to provide. So everyone should be excited about that.
And it's right here.
Absolutely. The cath lab, Howard Regional is already known as one of the best cardiopulmonary health centers in the nation. They got a U.S. News and World Report designation for that just recently. So they're going to go from their 2 cardio cath labs to a 3rd lab, which will further expand their ability to not only address a cardiac problem as it arises, but what they've learned through their process is they can actually take care of you en route. They're doing procedures on the ambulance now that's shaving 20, 30 minutes off your recovery time. It's mitigating a lot of damage that can happen in a cardiac event. And then they're going to move you into that cath lab, and you're going to get the best treatment there. Why go to Indianapolis and take that extra 45, 50-minute risk when every minute counts in a cardiac event? You can go right there to Howard, and you've got 3 labs to take care of you. The third big piece in this first phase is their magnetic resonance imaging center. They and St. Joseph Hospital had an MRI center out on Boulevard for several years jointly, but that didn't fit with the plans of either hospital long term. So Howard bought out St. Joe and then relocated some of that MRI service to the main campus there at Howard. But it's mainly an inpatient service. But there's a lot of demand for outpatient MRI treatments, and so what they're going to do is they're going to actually build a new facility near the emergency room that will be dedicated to that MRI, so that you can use inpatient and outpatient services there. That's a big upgrade for service for the community.
And it's a cost savings for patients that don't necessarily have to spend the night in the hospital. Is that correct?
I'm not sure how that works because there are outpatient MRIs that Howard and St. Joe both use. So I'm not sure how that works exactly. But having that on campus, there's a lot of efficiency there. We're not transporting people across town to get the MRI in an inpatient situation. If you are an outpatient, you go in there and they find something, you're right there with medical professionals. You're not going to have to reschedule or wait for a result. It'll be right there to be read. So there will be some speed up in the service delivery, it sounds like. That's just phase 1.
Yeah, which is wildly important to people who have ever stayed in a hospital. They know that quicker is better. That way they can get the help they need and move on.
Absolutely. Now, I'm just as excited about their second phase, which will take place right after that, which is these healthcare centers, the urgent care centers out in the community. They're talking about building two, or at least locating two of them, and these could be 24/7 healthcare centers where you can go in with any minor, non-acute symptom or affliction, and they will treat you there. It's a lot more affordable than an ER visit for the hospital and for the consumer.
Sure.
And the turnaround time, especially, what's like when you go to the ER, say after 8 o'clock on any given night, it gets really busy most nights. And if you've just got, a dislocated finger, let's say, that urgent care center is probably going to be a much better option for you in terms of cost and turnaround time. You're not going to be sitting for hours waiting for that service. Now, you're probably going to be dealing with a nurse practitioner in many cases there, but part of this implementation is Howard wants to hire 20 new primary care physicians and put them into their network and spread them across the community. So we're talking about adding them in the Greentown and Rocheville areas, all across the region, even going into adjoining counties to try to make this a truly regional network. So they're really beefing up their service and spreading it out where it's more accessible. And there's a big reason for all of this, and that is the Affordable Care Act.
Sure.
The Federal Health Care Act, it's here to stay. I know a lot of people don't like it, even though they don't really know anything about it.
You can probably hear the grumbling right now.
They can grumble all they want, but they're grumbling about things that they probably don't know what's in store for them. Well, one of the things that is in store for us is in 2015, everyone gets health care, whether they want it or not. And when you add that many more, we're talking about millions of more people into the system, you have to have a way to provide services. And that's what Howard is doing, is they're getting in front of this with community's help. Building these urgent care centers so that we can provide services to all these new people without doing it through the emergency room, which is so much more expensive. So it's the only responsible thing that a hospital can do, which is to prepare for the influx of what's going to be new clients, new patients. And I think everyone has a right to health care. And not everyone agrees with me on that one, but you're pretty callous if you don't. I have a right to health care just like you do. And under this act, we're all going to have to pay unless we make so little that we wouldn't be paying anyway. So we're not really getting over on anybody here. I mean, everyone, well, hey, I have to pay for my health insurance. Why doesn't he? Well, he will. Maybe he doesn't pay as much as you, but that will be a choice on your part because the Affordable Care Act says that you can't pay more than 12% of your annual income in premiums under that sliding scale. But if you decide that you want private insurance, hey, knock yourself out. Are you going to get better care? We don't know. It's still 2 years off. You can play the odds, and if you want to pay more for it, go ahead.
But at Howard,
exactly,
you're going to get that care, and it's going to be cream of the crop technology.
Right. So you're going to be going into the same hospital that the guys on the Affordable Care Act. I'm going to bet that those doctors and nurses over there are going to give the same quality of care no matter who you are. So,
well, and that's really the good thing about Kokomo and Howard County. Both hospitals live, play, and work here. I know I say that a lot, but it's the same people that you run into the grocery store. It's the same people that sit in the same church pew that you do, and this is the technology that's going to bring the insurance companies and all this stuff that you've been talking about straight together.
Absolutely. So, Kokomo needs to breathe a bit of a sigh of relief because we have an excellent healthcare system here that's only growing to accommodate what's going to be an increased need.
We're going to take a quick break, and we'll be right back. We are back, and there's all kinds of other exciting things. You're definitely going to want to check out this week's Kokomo Perspective. And like I always say, if you don't get it, 452-0055. Anyone who answers the phone can take down your address or talk to me. I'll be glad to take it and put you on the list. But, Pat, there's other exciting stuff going on.
Had a couple of really good stories that came out of the city this week. One, they settled a new 3-year contract with their park and street workers, AFSCME. So that union has settled for another 3-year deal. That's a good thing for the city. That means we're not going to go for months in arbitration and things like that, trying to settle a contract. It's always good to have that nailed down. And then the announcement that our trolley system is one of the most affordable public transportation systems in the nation. Not only to the consumer who's been riding for free for 3 years now, but also to the taxpayer who has to subsidize that. There is no free ride when it comes right down to it. Somebody's going to pay for those things to operate, and it costs about $400,000 a year in local tax money. to operate that system. But for that $400,000, we also get $1 million in federal transit grants to subsidize that system. And the more people who ride those trolleys, the more money that we're eligible for. So really, the users are helping drive the subsidy, making it more affordable with each passing year.
And is it true that they're going to even add more routes coming up? Is it April?
It is the plan. I believe the plan is that they will be expanding all 4. Currently they have 2 routes.
Sure.
A north-south and an east-west. Will become 4. It'll be a north, a south, an east, and a west. They'll each do an individual loop now instead of going north to south, which means you're going to see a bus more often in those legs. And they're going to expand that route. So, for instance, the south route is going to go to Indian Heights starting, I believe, this spring.
Now, will that help us in? I don't mean to cut you off, but will that help us in the grant money as well?
Yeah, how could it not? You're talking about 2,600 residences out there. That's a lot of people. And a lot of them in low to moderate income who could really benefit from a public transit system. And by getting on the bus in Indian Heights within an hour, they can be at Ivy Tech.
Nice.
They can be at IUK within 15 minutes. So they can be grocery shopping within 30 minutes. It's just depending on when you get on the bus system. So it's a real benefit to our new residents to the city of Kokomo who were annexed in starting this last year. So yeah, the transit system promises only to get bigger, which will mean that it will continue most likely to be free for people who want to ride it for the foreseeable future. And we'll see additional grant money, which will allow them to buy additional buses and keep things up and running. So who knows how big it'll get. And obviously there are a lot of areas of the city that could still stand to have some public transportation services moving into it. So it says there that we're over time, so we need to wrap it up.
I think Tim's telling...
I talked too long.
No, it's just so exciting. There really is a lot in this week's Kokomo Perspective, as is every week. So, but Jerry Paul is here, and he's going to come in. But Pat, thank you so much for writing and all these in-depth, exciting stories. And I know you're going to be back with another car.
Yes,
my favorite part.
We'll be reviewing the Town and Country. Have we seen the 200 yet? Have we?
Yes.
Okay, good. So yeah, the next one up will be the Town and Country, and then I'm driving a Jeep Grand Cherokee with an 8-speed transmission.
Nice.
So in the next couple of weeks, you're going to see some different things.
I've said it before, and I've said it again. It's one of those segments that I'm truly, truly glad that is brought back. So we'll be right back with Jerry Paul.